Your bedside shift report is disorganized and disheveled, and I am sure it is a mirror of the quality of care that you provide. I mean, it was for me. That's an accurate general statement that it pretty much have been shown to be true. Many times when I find Young Bear 44 that nurses who gave me disheveled and unorganized reports, it was always almost indicative of the care that they provided. And I know when my reports were like that, I know my care was like that. When I found that my reports, my bedside shift reports, were significantly longer than most people, it's because the oncoming nurse had to ask me several questions. Why did she have to do that? Because I was so disorganized. So when I completely fell back in love with nursing and caring about the quality of care I provided, I found that the quality of my bedside shift reports, it dramatically increased, and the time I spent giving report dramatically decreased. The thing is, I had so much knowledge, but I did not know how to apply it. But I didn't have wisdom. I didn't know how to apply that knowledge into the quality of care that I was providing. So I literally just scrapped everything and started from scratch. As a traveler, and I was in the float pool for a long time, to different units, and a lot of units tend to have their own report sheets. Move through and look at their different report sheets that each floor and hospital provided, and I just like kind of cherry picked from what I wanted from each report, and then I created my own. I just sat down one day at work, I had some downtime, and I created my own report in the flow of how things go in my head. Starting from the top, I frame my patient my own specially made report sheets. I have a scripture at the top of the report sheet, and I have a scripture on the bottom of the report sheet. There's a built-in blessing for everyone that reads the book of Revelations, right? So I did that. I built in a blessing for every patient that I touched. So once I wrote your name and your information and what's going on my report sheet, in my heart, I have faith that the Lord is going to touch you because I wrote your name and information on my report sheet. The next thing I do is that in my mind, I'm building an avatar. I'm assuming that the nurse that I'm giving a report to knows nothing about my patient. So in my head, I am forming this person in your head so that you can accurately depict who I'm talking to you about, right? So I first start with, this is Brenda Smith. She is a 56-year-old white female that was admitted yesterday with a primary diagnosis of pneumonia, sepsis, UTI. I always put their date of birth. I go in a order that makes sense and allows it to flow. Now, the way everyone does their reports is completely different and it's unique to them. For me, I found that my reports got significantly better when I wrote my report after I did my assessment, because I don't write down report when someone's giving me report, because if I am in the ICU, it's not that many patients, so I can remember. But not only that, I'm not relying on your report, nor am I relying on my memory. What I am relying on is my assessment findings, right? So you give me a report on the patient, and then I assess the patient, and then I go through the chart, and then that's when I write my report. So my report it got meat and potatoes. It's not just what someone else told me, it's not what just the computer told me, it's a combination. So it's a more robust report. Not only that, it allows my report to be more concise. It allows it to accurately depict the patients in the state that they're in. If you want like a real report, like, hey, I'm your nurse and I'm giving you a report, let me know. But the reason why I'm giving you these generalities is because I don't want you to want to give report like me. I don't want my flow to be your flow. I'm giving you just the things that you need to think about to give better report, right? I gave a nurse report, right? And the next day, came in and I didn't get the patient back because they were going to ship the patient out. Anyhow, I heard the night shift given the day shift nurse report that had the patient that I had, and her report was verbatim my report. Every single thing that I told her in the order that I told her, how she wrote down the report I gave her was exactly the same. Now, I'm not knocking her, but what I am saying is that when you give me report, when I'm giving report back on that same patient, it doesn't sound the same. Why? Because what I found was completely different. Or even if it aligned with what you found, two people can experience the same thing and articulate it two very different ways. So if you are regurgitating exactly what someone told you, sometimes I wonder how good of an assessment did you do? But I'm not being judgy, I'm not being picky. We were all somewhere on our journey, and I'm sure I was there at some point. But the goal is not to stay there. The goal is to always want to be better. That how do I make my own report? Well, I literally create my own report. Then I assess the patient, then I go through the chart, and then I write down everything in one concise sheet to help the nurse that's oncoming. I set her up for success, him or her up for success, so that they can do well on their shift. I hope that helped, and if you want like an actual report from me, I can provide that as well.